Hello, everybody. My name's Justin Andzel. A student at Grand Canyon University in the master's program for adult gerontology, acute care, nurse practitioner. Today, I will be presenting on the evolution of nursing informatics. The link will be available to this presentation after the presentation, and you can find it on YouTube. So, what is nursing informatics? The American Nurses Association defines nursing informatics in the following manner: the integration of nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. The course textbook defines nursing informatics in the following manner: the synthesis of nursing science, information science, computer science, and cognitive science for the purpose of managing, disseminating, and enhancing healthcare data, information, knowledge, and wisdom to improve collaboration and decision making, providing high quality patient care, and advance the profession of nursing. Nursing informatics utilizes technology to analyze data and trends to improve the process and quality of patient care delivered, promote evidence-based practice to limit adverse events, optimizes clinical decision-making, improves the efficiency and effectiveness of interventions performed, and promotes optimal patient safety and outcomes. History and evolution of nursing informatics. Florence Nightingale, pictured to the left here, is one of the first known nurses who collected, analyzed, and utilized the data to improve the quality of care she delivered to her patients. During the 1850s, Nightingale was caring for patients fighting in the Crimean War involving Great Britain, France, Russia, and the Ottoman Empire, who were fighting in modern-day Ukraine, the Baltic Seas, and Kamchatka Peninsula. During the Crimean War, Nightingale collected data regarding the patients' living conditions, diseases they acquired and died from, and later utilized this data to help implement improved patient conditions in city and military hospitals. In the late 1950s, Harriet Worley, a nurse researcher at Walter Reed Army Research Institute and nursing informatics pioneer, reached out to IBM to inquire about utilizing computers to improve the efficiency, accuracy, quality of healthcare data collection and analysis. Worley helped in the progression of the nursing informatics field by understanding the importance of collecting data from patients so that it could be analyzed, compared, and then utilized to make better clinical decisions and improve patient outcomes. By the 1970s and 1980s, computers were more developed and prevalent, and more nurses became aware of the potential benefits of implementing computers into healthcare to improve the efficiency and quality of care of the care delivery process. During this period, nursing leaders were advocating for increased informatic education and usage, developing terminologies to represent patient data, and performing informatics research. In 1989, Graves and Cochrane of Coracon developed the first well-known definition of nursing informatics, describing it as a combination of computer sciences, information science, and nursing science designed to assist in the management and processing of nursing data, information, and knowledge to support the practice and the delivery of nursing care. History and evolution of nursing informatics continued. In the early 1990s, the American Medical Informatics Association was established. An NI work group was developed. The American Nurses Association recognized nurses informatics as a specialty, and the first nursing informatics certification was introduced. Throughout the 1990s, nursing informatics pioneers and nursing leaders continued to advocate for the use of computers in healthcare, and the nursing informatic terminologies were developed. In 2004, President George W. Bush established a plan for all Americans to have an electronic health record within the next 10 years, with the goal of promoting high-quality patient care and reducing healthcare costs. In 2006, the Technology Informatics Guiding Education Reform, known as TIGER, initiative took place in the United States to improve patient care through the integration of health informatics into nursing education and practice. The official Nursing Informatics Scope of Practice document was first composed in 1994, and then in 2001, the American Nurses Association published a combined scope and standards document with revisions made and then published again in 2008. In 2010, the American Nurses Informatics Association and ANIA was formed when the Capital Area Roundtable on Informatics and Nursing and the American Nurses Informatic Association of Southern California merged with the goal of advancing nursing informatics through education, research, and practice. Nursing informatics effect on nursing leadership. Nursing informatics positively affects nursing leadership by providing them with real-time data and analytics, which allows them to make better informed decisions and develop proactive care interventions to more efficiently and effectively manage their team and the patients. Nursing leaders can also use informatics to help them discover gaps in care, advocate for changes to improve the quality and efficiency of care, and to assist in creating innovative ways to improve the patient care delivery process. Nurse leaders can also promote improvement in the quality of patient care delivered and patient safety by utilizing informatics to guide their research, quality improvement initiatives, and implementation of best evidence-based research and practice. Nursing informatics effect on clinical practice. Nursing informatics can also positively affect clinical practice in a systematic review performed looking at the use of nursing informatics in the critical care setting. The authors concluded that the use of informatics, including electronic health information record system, clinical decision support system, telehealth, continuous bedside pressure mapping systems, automated drug dispensing systems, and continuous glucose monitoring devices contributed to decreased adverse events, improved patient safety, improved patient outcomes, improved efficiency, and reduced cost. The use of the electronic health record EHR also allows nursing staff and providers easy access to real-time patient data and analysis to make high-quality decisions, implement the best practice interventions, and optimize patient outcomes. The EHR also provides high-quality patient data and analytics to be viewed and shared to all members of the interdisciplinary care team, leading to proficient communication and fewer mistakes. Nursing informatics effect on administration. Nursing informatics can positively impact administration by improving efficiency and optimizing processes. By implementing informatics, by by implementing informatics, clinical and administrative processes can be optimized, performed more efficiently, and cost effectively. Nurse administrators benefit from implementing informatics by reducing distractions in the clinical environment, leading to increased productivity, effectively organizing data in the EHR for effortless access and reporting, and utilizing systems to streamline daily operations and manage the payroll process, incorporating technology that optimizes processes and improves staff productivity and patient care. Nursing informatics effect on education. Essential competencies in nursing informatics include information literacy, computer literacy, the ability to utilize strategies and system applications to organize and manage data, knowledge and information, and computer-mediated communication skills. Achieving mastery of these competencies are an important factor in the success of future nurses to improve patient safety and quality of care. It is important to include informatics competencies into practice standards in healthcare settings and promote nursing continuing education of electronic health records and health information technology. Nursing informatics also affect education by requiring educators to integrate informatics, AI concepts, simulation, data analysis, and using AHRs into the curriculum to prepare students for progressing and evolving technology-driven healthcare environment. Education is also affected by informatics in that technology provides educators and students with improved access to current, evidence-based data and information. Nursing informatics effect on research. Research is also impacted by nursing informatics. EHRs provide researchers access to vast amounts of databases to analyze data, to discover trends, compose quality improvement initiatives, and implement changes to improve the quality of care and patient outcomes. In a Nursing Informatics Journal article, the authors discuss how nursing informatics can be used to conduct effective research through data-driven analysis to improve practices and should be utilized to guide future research to provide patient data and framework for implementing the research into high-quality patient care. Researchers are also able to utilize nursing informatics when analyzing patient outcomes to help them determine opportunities for growth and guide them in developing and implementing new improved strategies to improve the healthcare delivery process, improve efficiency, improve patient safety, and improve outcomes. Healthcare information systems, organizational policy, and governmental regulation. Public policy and regulations are essential components of health informatics and establish the framework of health information systems and electronic health systems. Health information systems, HIS, technology continues to develop, evolve, change, and dictate the way healthcare is delivered. Governmental regulatory bodies compose and apply policies to facilitate the implementation of electronic health records and regulate the system to ensure and safeguard patients' and providers' rights. The Office of the National Coordinator for Health Information Technology operates under the authority of the United States Department of Health and Human Services, HHS, and works to create and establish EHR policies, standards, and certification credentials. The created EHR policies and standards are enforced by the Centers for Medicare and Medicaid Services, CMS, linking them into Medicare and Medicaid program participation and incentive payments. The Health Insurance Portability and Accountability Act, which was implemented by HHS, develops and enforces federal standards for protection of patients' health information. For healthcare organizations to be compliant with standards, regulations, and the framework implemented by governmental regulatory bodies, it is essential that they develop and implement health information systems internal policies that meet these standards and regulations. Accountable care organizations, ACOs, are also governmental supervised entities that are composed of healthcare providers and hospitals that work together to deliver high-quality care with the goal of improving patient outcomes, reducing cost, and preventing unnecessary healthcare services. When ACOs improve the quality of patient care and outcomes, reduce cost and errors, they receive financial incentives that are shared among the providers. Governmental regulatory bodies make sure that ACO treatment plans are properly implemented to meet the quality of care requirements. Nurse-led innovation and advancements in nursing informatics. Quality is the major driver and focus of nurse-led innovations pertaining to informatics and is composed of safety, efficiency, effectiveness, equity, timeliness, and patient-centeredness. Nurse leaders heavily rely on informatics to acquire healthcare data and information to cultivate new knowledge and guide them in developing innovations to enhance the quality of care delivery. It is essential for nurse leaders to ensure that nurse-led informatic innovations are geared towards the improvement in quality measures. Recent advancements made in nursing informatics and technology have provided nurses with access to tools like electronic health records, data analytics, and artificial intelligence, which can be utilized to develop innovative ideas and create new procedures and policies that can be implemented to improve the care delivery process, efficiency of care, improve the quality of patient care, and patient outcomes. Nursing informatics provide nurses the necessary data and analytics analysis to uncover gaps in the care delivery process, enhance patient assessment and monitoring, and simplify administrative duties, allowing for increased time and energy to be focused on providing direct patient care and discovering innovative solutions. According to Shepard and McCarthy, nurses are the link between technology producers and clinical applications to ensure that technologies are appropriate, safe, and patient-friendly. Nursing informatics, innovation and improved quality of care. Informatics innovation can be used to improve the quality of patient care, improve patient safety, and improve patient outcomes. EHRs provide nurses and providers with easily accessible, real-time, comprehensive, organized, and accurate patient data that gives nurses and providers the ability to quickly assess and analyze the data, communicate, coordinate care, make better decisions, and implement more effective and efficient interventions and treatments that lead to improved quality of care, improved safety, decreased cost, and improved patient outcomes. Providers have improved access to patient information and documentation that leads to better communication between interdisciplinary team members and patients, which minimizes mistakes and enhances patient safety. Informatics technology and tools also provide nurses with increased access to the most current evidence-based practices and research, which guides them in their care to make better decisions, implements best practices, and ultimately improves the quality of care delivered and patient outcomes. Nurses utilizing nursing informatics to improve the quality of care delivered case study. In an article from the Canadian Journal of Nursing Informatics, an irritable bowel disease, IBD, nurse educator discusses how she utilized nursing informatic principles to enhance the education process to patients and to improve their outcomes. The nurse educator's role was initially established to address gaps that were identified in the patient education process and to provide patients with education regarding their diagnosis and treatment options and complement the care delivered by their healthcare provider. The IBD nurse educator delivered education to patients by telephone or by secure virtual platforms, often with patients in the safety and comfort of their own homes, with the objective of providing patients with the necessary evidence-based data and information that they needed in a customized, authentic, patient-centered approach so that they felt empowered to make the best decisions about their disease treatment plan in collaboration with their physician. Case study continued. The patients reported feeling more confident and comfortable that they were educated, supported, and provided the opportunity to ask questions at both a time and place that was convenient to them, and were also actively involved in their treatment plan. A survey was performed on over 200 patients who completed a telephone or virtual appointment with the IBD nurse education team, and the consensus was that the education was high quality, patient-centered, holistic, and compassionate, and left the patient much more confident and prepared to take the next steps in their disease management process. This illustrates how the IBD nurse education team was able to integrate technology and informatics to deliver high-quality, patient-centered education, track and monitor patients' progress, guide patients to make informed decisions, and collaborate and coordinate care with the physicians in real time to improve the care delivery process and improve patient outcomes. With the use of nursing informatics and technology, the nurse education team was able to overcome geographical and logistical barriers and incorporate evidence-based data to develop a program design that enhanced the quality of patient care, optimized the patient experience, and improved patient outcomes. Thank you for listening to my presentation on nursing informatics. And these are my references in the next 3 slides. Thank you.